reduction maneuver that we do in the operating room, and I think it's important to discuss the positioning of the patient. So typically we'll have the patient supine position on the operating room table, and typically we'll have an arm board attached to the operating room table. And what's important is that arm board is radiolucent, because we're going to have fluoroscopy coming in and taking shots through the arm board. And the technique to close reduce a supracondylar fracture would be to take the elbow out into extension, have longitudinal traction. So sometimes this entails having an assistant holding the shoulder so that you're not pulling the patient off the operating room table when you're doing that longitudinal traction. You hear these horror stories. So that's the big
Right, a bit of counter traction is always key.
Exactly. The next step is to correct the varus and valgus deformity, and that's the deformity that you might see if there's medial comminution. And then the next step is to correct any medial or lateral translation. So you're correcting the coronal deformity